Once you've had a vasectomy, it's impossible to get a woman pregnant, right? Wrong. Men do get their partners pregnant after a vasectomy, and in almost every case, the surgery worked fine. The mistake was made in the weeks after the man left the clinic. There is a specific window between the procedure and confirmed sterility where unintended pregnancies do happen. The men who end up getting their partner pregnant during this window believe they were already past it. We've seen this pattern across more than 30,000 vasectomies at our 5 locations over more than 20 years. It isn't rare, it's common, enough that we covered it at every consultation. And it comes down to 3 specific mistakes men make after the procedure. In this video, we'll walk you through those mistakes. We'll explain what's happening in your body after the procedure and why having surgery completed isn't the same as mission accomplished. And we'll tell you exactly what the confirmed result looks like so you know when you've actually crossed the finish line. Here's what most men understand. The surgeon cuts the tube, the sperm can't get through, so the job is done. Here's what's happening in your body. When we perform a vasectomy, we cut and remove a section of vas deferens, which is the tube that carries sperm from your testicles out of your body. That tube is now interrupted. Above that interruption are sperm that were present before your vasectomy and are still viable. Those sperm will be ejaculated and can still get a woman pregnant. Your body doesn't flush that sperm out when we perform the vasectomy. It clears over the weeks and months that follow as that sperm works its way through ejaculation or gets absorbed. And that process isn't immediate. In the first weeks after the procedure, the sperm above the cut is still part of your ejaculate until your body has fully cleared the pathway. Your body does the clearing. And that clearing doesn't happen overnight. It can take several weeks or months. The exact timeline and number of ejaculations varies from person to person based on factors your body controls, not your surgeon. The only way to know when that clearing is complete is to test. That gap between the procedure and that final all-clear test result is where the 3 mistakes happen. This is the most common mistake, and the one responsible for most post-vasectomy pregnancies. Men stop using contraception the day of the procedure or within a few days of it because the surgery is done. The procedure went well. Recovery is going normally, so it feels like the risk is gone, but the sperm upstream of the cut are still there, still viable, and still capable of causing a pregnancy. The surgery interrupted that path that sperm uses to travel, but it didn't remove the sperm that was already above that interruption. Men who stop contraception in this window aren't being careless. They genuinely believe they're past it. That's the reason this mistake happens so often. It feels like the right move at the time, and nothing in the recovery tells them otherwise. The incision heals, the soreness fades, most of our patients are back to work the next day and resume their normal activity within the week. Nothing about that experience signals that sperm is still viable in your system. Your body gives you every signal the job is done and except the one thing that actually confirms it. That confirmation comes from a lab result, not from how you feel. Contraception has to stay in place until a semen analysis confirms there's no sperm left. Keep it in place until you have that result. There's no version of "I'm probably fine" that substitutes for it. If this kind of straight answer is what you were looking for, go ahead and subscribe. We put out a new video every week that covers the questions men actually have about vasectomies, and the answers go further than what you'll find on most clinic websites or patient forums. The semen analysis is the test that confirms your vasectomy worked. The lab checks a small sample under a microscope and looks for sperm. When they find the absence of sperm, that means you're no longer able to get a woman pregnant. That result is the confirmation, and it's the one step you can't skip. Some men never go back for the test. The procedure went well, recovery was quick, everything feels normal, so they assume the result would be good. But a vasectomy can fail without any symptoms at all. The tube can recannulize, which means it reconnects itself over time. A man with a completely normal recovery can become fertile again without knowing it. That outcome isn't common, but the only thing that catches it is the semen analysis, and without it, you're just guessing. The second reason men skip the semen analysis is simpler. They weren't clearly told they needed to do the test. At our practice, we follow up with every patient directly. We track where each man is in the process and reach out with general reminders to get your tests done. The doctor will review the testing with you when you come in for your consultation. You'll also be reminded on the day of your procedure, and our team will follow up with you as well. Our standard at VCC is 2 semen analyses, not 1. The first tells us the status of the sperm in the tube above the separation. The second confirms there's been no reconnection and you get the all clear. This is our process before we can tell a patient the procedure was a success. We have a patient we think about when this comes up. His wife had factor V Leiden. It's a blood clotting disorder that made hormonal birth control life-threatening for her. They'd spent years managing the anxiety of an unexpected pregnancy together, and he came in wanting to end that worry for good. He understood what the semen analysis was for. He wanted to do it 4 times instead of our standard 2, because he wanted to be absolutely certain that he wouldn't put his wife's life in jeopardy. Once he had 4 clear results in hand, he called us to tell us the relief he felt was stronger than anything he'd expected. Their relationship and their sex life was different after that. They finally got to enjoy the freedom of being worry-free during intimacy. The bottom line is that having the procedure isn't what gives you the all clear. It's the test results. Men who treat the semen analysis as optional are treating the surgery as the finish line, and it isn't. This mistake catches men who've already done the right thing and scheduled the semen analysis. They go to the appointment. They feel like the appointment is the confirmation, and they stop using contraception before the result comes back. The confirmation is the result in your hands, not the appointment. There's a gap between going in for the test and getting the lab report back. Men who stop contraception in that gap are making the same error as men who stop the day of the surgery. They're acting on an assumption instead of a confirmed fact. The same issue comes up with timing. Some men go for the semen analysis too early. Your body needs weeks and sometimes even months to clear the sperm above the cut. If you go in before that process is finished, a semen analysis will still show sperm. That isn't a failed vasectomy. It's an early result that doesn't tell you anything useful yet. And that early result can create a problem on its own. Men who go in too soon and see sperm in the sample sometimes assume the vasectomy didn't work. They stop following up. They never go back for their second test. But the procedure was working. The body just hadn't finished clearing. Going in too early doesn't catch a problem. It creates confusion that leads men to abandon the one step that would have confirmed everything was fine. Your doctor will tell you the right window for your post-vasectomy semen analysis. Go when they tell you to go, not when you think you're probably ready. And some men complete 1 clear result and stop there. In our practice, our standard is 2. 1 clear result is good news. 2 clear results is confirmation. Here's what the complete process looks like. 2 semen analysis, both clear, results in hand. Keep contraception in place until that moment, and then you're done. If you're watching this and you've already stopped using contraception before getting 2 clear results, the move is straightforward. Call your doctor and schedule the semen analysis. If it's been fewer than 8 weeks since your procedure, you may be going too early for an accurate read, and your doctor will tell you when the timing is right. If you've already had 1 clear result and stop there, go back and complete the second. The first result tells you it's going well. The second test tells you you're done. Until you have the confirmed result, you don't know for certain. After you have it, you do. That's the entire difference between the men who end up with a problem and the men who don't. The vasectomy procedure works. We know that because we've done more than 30,000 of them. But the procedure working and the procedure being confirmed aren't the same thing. Confirmed means 2 clear semen analysis results, both in hand. That's the finish line. What men tell us after completing the full confirmation process is consistent. The mental load goes away. The background stress with every intimate moment goes away. Men who've waited for both clear results describe something specific. They say they feel like they finally completed a decision they made months ago. The second clear isn't just a piece of paper, it's the thing they actually came in for. If you haven't booked a consultation yet and you're still in the research phase, we have a video that covers exactly what to expect at that appointment. It's called Before You Book a Vasectomy, Watch This.